Good morning, everyone. I, Dr. Pooja Thakur, Assistant Professor in Kayachikitsa, welcomes you all on the 11th day of Ayush Vibhodhini 2. This webinar series is possible by the blessings and immense support of our respectable Chairman, Sir Engineer Amarjit Singh Walia. This series is a vision of our Principal, Dr. Meenakshi Nath, and Vice Principal, Dr. Mridu Sharma, who are working very hard for the successful conduction of this event. I, on the behalf I, on the behalf of my other coordinators, Dr. Deepika Minhas, Dr. Jyoti, and Dr. Sonika, would like to extend my thanks to our worthy principal and vice principal for giving us such an opportunity, which will surely boost our confidence and will be beneficial to us in future. Now, I would like to invite our vice principal, Dr. Mridu Sharma, to share her views. Over to you, Dr. Mridu. Dr. Mridu, kindly unmute yourself.
Okay. Am I audible now?
Yes.
Yes. Thank you. Good morning, everyone. I, Dr. Mridu Sharma, Vice Principal, Srimati Urmila Devi Ayurvedic College, welcomes you all on the 11th day of Ayush Vibhodhini 2. This series is possible by the inspiration and support of our Chairman, Engineer Amarjit Singh Walia, and Principal Dr. Meenakshi Nath. Who are always inspiring us to progress further. I want to appreciate the efforts of our coordinators, Dr. Deepika Minhas, Dr. Pooja Thakur, Dr. Sonika Jaryal, and Dr. Jyoti Saroa, who has made all the functioning of this event very smooth. Now, I would like to welcome our guest speaker, Dr. KHEMRAJ TIMILSINA, who has done great work in the field of research in Ayurveda. Thank you, Dr. Khem, for joining us and accepting our invitation. I'm sure our delegates will be highly benefited from your immense knowledge. Thank you. Over to you, Dr. Pooja.
Thank you, Dr. Mridu. Now it's the time to introduce our first international speaker for this webinar series, Dr. KHEMRAJ Timilsina. He hails from Nepal and has done his bachelor's degree from Tribhuvan University, Kirtipur, Nepal in 2016. He has completed his PG in Kayachikitsa from Rajiv Gandhi Government Postgraduate Ayurvedic College, Paprola. He has worked as research officer in National Ayurveda Research and Training Center, Kathmandu, where he has assisted many research projects like studying the pattern and efficacy of a Himalayan medicinal plant Nordostachys grandiflora. During his post-graduation days, he has conducted preclinical and clinical study in zebrafish rats to study the efficacy of Arjun Kshirpak in the management of Meduru. I know him personally since his post-graduation days, and he has always been helpful and good motivator to me. Today, he will share his knowledge on the topic and overview of pain management. Over to you, Dr. Kim.
Uh, Thank you, Dr. Pooja. Am I audible?
Yes, sir.
Hello.
Audible.
Okay. Thank you, Dr. Pooja, for your nice introduction. Myself, Dr. KHEMRAJ Timilsina from Pokhara, Nepal. Without much further ado, I would like to proceed with my presentation. And before proceeding, I would like to thank respected principal ma'am, vice principal ma'am, Dr. Pooja, for providing me this platform to share my views and ideas on pain management. So let's get started with today's presentation. Okay. So the today's topic is an overview on management of pain. So in spite of very advanced researches in science, pain still remains the major cause of a disability affecting large number of population in the world. An integrated approach towards pain management should possibly answer the grief involved in treating pain of varying degrees. So Life is a journey that begins with pain and ends in pain. So pain is a true friend who walks along and tells us when something is wrong in our body. So let's define the pain. The International Association for the Study of Pain has defined pain as an unpleasant sensory or an emotional experience associated with actual or potential damage of tissue. Pain is highly subjective, which often leads to undertreatment.
Sorry to interrupt you, Dr. Khem. Slide is
Okay.
not working.
Okay. Is it working now, ma'am?
No, slide is not working. Should we share it from our end? Yeah. Now
Okay.
the screen is visible. Yeah, you can start the slide.
Okay.
Yes.
Thank you.
Yeah.
Okay. So let's start again from the definition of pain. The International Association of Pain, of study of pain, has defined pain as an unpleasant sensory or an emotional experience associated with actual or potential damage of tissue. So pain is highly subjective and which often leads to undertreatment. Classical text on Ayurveda, uh, like Sushat Samhita, explains pain is a separate entity termed as soul, which basically implies colic. So the concept of pain in Ayurveda, in Ayurvedic texts, various terms such as Ruk, Ruja, Vedana, and Sul are commonly used to infer pain. However, Sul is more appropriate term among all, which means a condition with state of discomfort to body and mind. Out of three doses, vitiated Vata is the main causative factor responsible for all painful conditions. Vitiation of Vata occurs in two ways, namely Dhatuchayajanya Vata Prakopa and Marga Vrojanya Vata Prakopa. The Rukshya and Chala gunas of Vata are mainly involved in manifestation of pain. So is a pain a friend or a foe? Actually, pain is a true friend that tells us something is wrong in our body, but it is always considered as an enemy. So some of the painful conditions that we have to deal in our clinical practice in day-to-day life are osteoarthritis, gouty arthritis, rheumatoid arthritis, spondylitis, frozen shoulder, back pain, neck pain, sciatica, fibromyalgia, headache, etc. So some terms for pain in Ayurveda according to site, like Shirshul, Prishtasul, Udarsul, Rithsul, Parshvasul, and Karnasul. And some terminologies that we have to be accustomed while talking about pain are hyperalgesia, which is an exaggerated response to a stimulus which is usually painful, and allodynia, it is a pain is from stimuli that doesn't usually cause pain. In some cases you might find hot or cold temperatures painful. You might find a gentle pressure on your skin painful. And breakthrough pain, it is a sudden and brief flare up of pain from a chronic condition like arthritis or cancer. Even if you have been managing your pain with medications, during this flare up the pain becomes severe enough to break through the pain medication you are taking. And refractory pain or intractable pain, it is a type of pain that can't be controlled with standard medical care. This type of pain isn't curable, so the focus of treatment is to reduce your discomfort. And phantom pain, it is a pain experienced in a missing limb or in an amputated limb. So pain is now considered as fifth vital parameters to be monitored for every patient as per World Health Organization's guidelines. So let's move on to the classification of pain. Basically, pain is classified into three types: nociceptive pain, neuropathic pain, and mixed type of both. So nociceptive pain, it is caused by activity in neural pathways in response to potentially tissue damaging stimuli such as post-operative pain, mechanical low back pain, sports or exercise injuries, sickle cell crisis, arthritis, Similarly, neuropathic pain, it is initiated or caused by primary lesion or dysfunction in our nervous system, such as complex regional pain syndrome, trigeminal neuralgia, central post-stroke pain, distal polyneuropathy, as in diabetes or HIV/AIDS, neuropathic low back pain, and post-herpetic neuralgia. So some of the features of neuropathic pain: the pain is burning, stabbing, or pulsating type, spontaneous without ongoing tissue damage. Pain occurs in the area of sensory loss. Hello? Sorry. Presence of a major neurological deficit. Pain in response to non-painful stimuli, as we have discussed earlier, allodynia, and increased pain in response to painful stimuli, like in hyperalgesia. Unpleasant abnormal sensation, dysesthesia, and poor relief from opioid alone. So types of pain: acute pain and chronic pain. Chronic pain is of again two types: non-malignant and malignant type. So the acute pain: injury, trauma, spasm, or disease to skin, muscle, or somatic structure or viscera causes the acute pain, and it is perceived and communicated through peripheral mechanisms, usually associated with autonomic response as well, such as tachycardia, increased blood pressure, diaphoresis, that is excessive sweating, pallor, mydriasis, and it usually subsides quickly as pain producing stimuli decreases. It is associated with anxiety and it decreases rapidly, can be understood or rationalized as a part of healing process. About chronic pain, first, a non-malignant type. The non-malignant pain, it persists beyond the precipitating injury, rarely accompanied by autonomic symptoms. Sufferers often fail to demonstrate objective evidence of underlying pathology, and it is characterized by local location, like visceral, myofascial, or neurologic causes. So, and the second type, malignant type of chronic pain, it has characteristics of chronic pain as well as symptoms of acute pain, and it has a definable cause like tumor recurrence. In treatment, narcotic habituation is generally not a concern in this type of pain. Now, on to the psychological aspect of chronic pain. Perception of pain is influenced by many factors other than painful stimulus, and the pain cannot therefore be classified as wholly physical or psychogenic in any individual. Patients suffering from chronic pain will be affected emotionally, and conversely, the emotional disturbance can augment the pain. Therefore, the full assessment of symptoms of anxiety and depression are essential for effective pain management. And effects of pain: the sympathetic effects like pallor, increased blood pressure, increased pulse, increased respiration, skeletal muscle tension, diaphoresis. And parasympathetic responses like decreased blood pressure, decreased pulse, nausea and vomiting, weakness, or loss of consciousness are some of the effects precipitated by the pain. So now moving on to the management of pain, the main topic of today's discussion. So approaching the pain management, there should be proper assessment of pain through proper history taking and examination. Side by side, appropriate investigations are to be carried out for proper diagnosis, and finally the management protocols. The assessment and measurement of pain. Appropriate assessment of pain is the first step of pain management. History and measurement of pain. First, a detailed history is to be established about the causes and underlying diagnosis. Patient may have more than one pain at a time, like bone and neuropathic pain may arise from skeletal metastasis. Always ask the patient to rate the pain first. Then believe the patient's self-report of pain. Take a careful history based on Socrates' rule, like onset, location, duration, character, aggravating or relieving factors, response to analgesics, degree of intensity and interference with patient's life, and associated signs and symptoms. So how the pain is measured? Basically, there are various rating scales for measuring pain, and uh, some of the commonly used scales are verbal rating scale, visual analog scale, and behavior rating scale. The verbal rating scale, uh, it it rates pain is mild, moderate, or severe. And visual analog scale, for this asks the patient to rate the pain. Give 0 score for no pain and 10 for the unbearable pain, the worst pain. And accordingly, the pain can be measured. And behavior rating scale, it is commonly used in patients with cognitive impairment. Variety of measures are available, such as observe for agitation and withdrawal of the posture. So pain management, it can be divided into non-pharmacological measures and pharmacological measures. So non-pharmacological measures include yoga, meditation, pranayam, etc. And yoga, it brings energy and flexibility to the body. It reduces stiffness of muscles and joints, controls mind, and promotes general well-being. Pranayama, it is valuable tool to manage pain. It increases the pain threshold and regulates the breathing, vitalizing the body. It and cultivating a positive state of mind. Meditation, it reduces anxiety and stress in painful conditions. It improves mental and emotional states. It helps to improve mood and helps to improve the quality of sleep. So the pharmacological measures, WHO analgesic ladder, it is a standard protocol for management of pain. For mild pain, non-opioid medications are used along with adjuvants as per the need. Adjuvants, analgesics, these are basically the drugs with a primary indication other than pain, but provide analgesia in some painful conditions and may enhance the effect of primary analgesics. So for mild pain, non-opioids, and if the pain persists or increases, then weak opioids are used along with non-opioids and adjuvants as per the need. Similarly, if the pain still persists and increases, the strong opioids are the drug of choice for severe pain, along with the use of non-opioids and adjuvants. So consider prophylactic laxatives to avoid constipations and side effects of these medications. Some of the non-opioids like ibuprofen or other NSAIDs, paracetamol or aspirin. Weak opioids like codeine, tramadol or low-dose morphine. Strong opioids are like morphine, fentanyl, oxycodone, hydromorphine, and buprenorphine. So the Ayurvedic approach of pharmacological management of pain. Pain management in Ayurveda has a holistic view, which incorporates several therapeutic procedures and behavioral modifications under the light of basic principles narrated in Ayurveda. Prescription writing for pain in Ayurveda is varied, as Ayurveda considers pain as a subjective phenomenon, which includes therapy to both body and mind. So some of the therapeutic procedures for the pain management. First, snehana. Snehana implies oleation of the body. It includes lubrication of body, chiefly with medicated oil. Vata dosa, dhatu chayajanya vata dosa gets pacified by snehana. So as per the patient's requirement, snehana is classified as abhyantara snehana and bahya snehana. Neurohormonal effects due to bahya snehana has been established, stating that massage increases level of dopamine, increases availability of serotonin, and may elevate epinephrine and release of endorphins. All these neurohormones alter brain chemistry, which ultimately help in reducing the pain sensation. And Swedana. Swedana implies herb fermentation, which helps in inducing sweating to the patient, and it pacifies Vata dosa. vitiated due to increase in its Sita property. The role of Swedana is best understood with transient receptor potential channels, which are responsible for perception of heat and pain, thereby facilitating the role of Swedana in the management of pain. So, Agnikarma is one of the most effective parasurgical procedures mentioned for the management of pain, which is done with the help of Salaka. This is a unique procedure which helps in relieving pain in various painful conditions like musculoskeletal pain, as in a Sandhigat Bath or Ababahu, to name the few. And it produces Usnaguna, which helps in pacification of Bata Kapha dosa, thereby reducing the pain. The role of Agnikarma in management of pain is explained on the concept of reduction in pain perception, counter irritation, and muscle relaxation because of this Agnikarma. Another procedure for pain management is Jalaukabacharana, which is one of the therapeutic procedure of Raktamakshana. This therapy of pain relief involves application of Nirvish Jalauka for removal of vitiated blood at the site of pain. Vidyakarma, which is also known as Vedana, is one of the 8 Shastra Karmas mentioned in Susrit Samhita. This is a sterile procedure which includes piercing the points with special hollow needles, considering the anatomy of marma. The piercing leads to painful mechanical stimulus, which causes a release of endorphins, thereby causing immediate pain relief. So another therapeutic procedure is a Lepan Karma, which is a application of medicated paste on the skin. And classical texts describe utility of Lepa in the treatment of Bata Rakta. Susruta has mentioned Lepana Karma in Togat Bata and Mamsagat Bata and Snayuroga. Mode of action of Lepan Karma can be explained with the help of transdermal absorption of drugs that possess analgesic properties. So moving on to the next therapeutic procedure, Basti Karma. It is one of the chief therapeutic procedures of Panchakarma, which is in which the drugs are administered into the rectum of the patient. Sensation of pain is attributed to vitiated Vata dosa, and in order to correct this dosa imbalance, Basti is the chief treatment of choice. Its principal seat of Vata dosa is Pakwasa. Another procedure is Marma therapy. Application of pressure on marma points induces the flow of vital energy along a complex system of subtle channels called nadis. It pacifies Vata dosa, creates physical, mental, and emotional flexibility, and it is useful in managing pain in number of conditions such as migraine, joint pain, muscle strain, frozen shoulder, sciatica, Bell's palsy, trigeminal neuralgia, etc. So other upakramas for pain management. In addition to several therapeutic procedures discussed above, the specific upakramas modalities are helpful in pain management as per the location or site of the pain. Like for pain in Urdhva Jatrugat area, specific upakramas like Sirodhara, Abhenga, Pichu, Anjan, Netratarpan, Karnapuran, Karnadupan, or Kaval and Gandus are indicated in Urdhva Jatrugat pain. Similarly, in Urustana, pain in chest region, Baya Snena Swedana, Sthanik Basti like Rid Basti and Prishta Basti are indicated. Similarly, pain management in chest region due to Swasaroga, as in bronchial asthma, it is done with the application of oil mixed with Sandavlavan on Uristana. As stated earlier, Snehapana, Anuloman, Virechana, Batanuloman are done in Udargat region. And in Sakha, when pain occurs in Sakha, like in extremities, modalities like Abhenga, Sthanik Basti, Basti Karma are mentioned, which are mentioned earlier, are prescribed as per the painful ailment. In treatment options, for Chikitsa of pain management in Ayurveda, Charak Samhita has explained 3 Mahakasayas: Angamardha Mahakasaya, Sulaprasamana Mahakasaya, and Vedana Stapak Mahakasaya. Angamardha Mahakasaya consists of herbs with both Sita and Ushna properties, which indicates treatment options and choice of herbs as per Angamardha due to Dhatuchaya and Margabrodjanya Vata Prakop respectively. Similarly, Sulaprasamanya Mahakasaya consists of all Ushna Virya herbs, which chiefly act on gastrointestinal tract, therefore important in abdominal colic. And Vedana Stapak Mahakasaya consists of herbs with Kasairas and Sita Virya properties and is described after Sonit Sthapna Mahakasaya, thereby indicating its action in pain of traumatic conditions. So these are some of the drugs, single herbs, which are mentioned in different Mahakasaya. Some other common herbs useful in pain management are Ahifen, Bhang, Kuchila, Gugulu, Tagar, Saral, Sigrur, Gandha Prasarini, Salparni, Hingu, Evani, Dhatura, etc. Some of the useful drugs for neuropathic pain like Kuchala, Tagara, Ashwagandha, Parijat, Vacha, Kapikakshu, Chetamamsi. Treatment options in Ayurveda in different types of pain, like in bone pain, usually Gugul, Rasana, Nirgundi, Sigru, Ahifen, Bhang are particularly useful in the treatment of bone pain, whereas in case of increased intracranial pressure, herbs like Jatamamsi, Trinapanchamul, Punanava are basically indicated. Similarly, in case of abdominal colic, herbs like Ajamoda, Hingu, Parasikevani, Evani are particularly useful. And in case of liver capsule pain, herbs like Katuki, Bringaraj, Kalmek, Bumyamliki, and Sarpunka are very much useful. Finally, the Saptavajaya Chikitsa, the psychological intervention is one of the important aspects of pain management in Ayurveda. Saptavajaya Chikitsa for pain management focuses on counseling of the patient, which encompasses understanding of the physical and emotional consequences and the limitation of pain, followed by its acceptance. So finally, the conclusion. Ranging from mild to severe pain, Ayurveda is a ray of hope to many people across the globe. Simple yogic procedure, panchakarma procedure like Snehana, Swedana, Basti, and single or compound drug preparations can be used for the specific pain. Increase in pain threshold is a whole new approach towards pain, and key to success in pain management is proper evaluation and rational selection of therapeutic modalities. Thank you. Thank you. Stay pain free.
Thank you, Dr. Khem, for such an informative session. This lecture will be beneficial for students as well as for clinicians. Anyone having query can unmute themselves and ask questions.
Doctor, please repeat again Apabahuka management.
Sorry.
Apabahuka pain management.
Of Bahuk.
Frozen shoulder or very
Frozen shoulder. Especially murmur therapy is very much useful in treatment of upper bowel. Similarly, panchakarma procedures like Snehana Swedana are also useful modalities in treatment of upper bowel like conditions in Ayurveda. And many herbal formulations are also there for pain management as per Saman Chikitsa.
Any Lepna choice is there?
Hello?
Doctor, any Lepna choice is there?
Choice, what choice? I'm sorry, I cannot
Lepana, any Lepana choice is there?
Lepan is also one of the important, one of the very useful modality for the frozen soldier, but specifically speaking, I have not practiced it, Kayachikitsa for frozen soldier. So I think you have asked for a specific Lepan. Hello.
Okay, doctor. Okay, okay, doctor. Thanks.
I think
Thank you,
everybody is clear with this concept. Dr. Khem, thank you for joining us. That is
Okay,
the end
okay.
of the session. Thank you so much.
Okay, thank you very much, Dr. Pooja.
Thank you.